My name is David Choi. I'm a consultant neurosurgeon at the National Hospital for Neurology and Neurosurgery. I've been a consultant for more than 20 years now, and although I am trained in all types of neurosurgery, my specialty interests are spinal surgery, so any part of the spine, cervical, thoracic, lumbar spine, different conditions, age-related conditions, disc problems or tumours. But I also do some brain tumour work called skull-based surgery, which is a difficult area of the brain underneath the brain, which needs access through the nose and different parts of the head to access, which is quite technically challenging. So I do endoscopic surgery for that as well. So I'm an academic at UCL, so my research projects involve cellular therapies to try and grow nerves back, as well as tumour work, looking at the outcomes of surgery for different types of operations. And a big question for surgeons is when to operate, because if you operate too often without a need, you'll have more complications. But also if you don't operate, then if someone's got a tumour, that's going to cause a complication. So working out when to operate is quite a tricky thing. So we can monitor outcomes now, looking at data sets and see which patients did well in the past, when to offer surgery, when not to. And always the patient has the final decision with the choice whether to operate or not. But at least we can advise them on, this is our past experience, this is what you could expect. It's important to interact with the patient just like any person, to talk about the options, what are the pros and cons of different treatments, what would I do as a surgeon, what would I do if it was my relative, and go from there. And part of that process is trying to explain things in terms which people can understand. So if the patient is another doctor, I'll probably speak slightly differently compared to if the patient doesn't have any medical background at all. I'll generally advise what I think should be done, but it's down to the patient to consider this and decide what they want to do, because they may have a slightly different take or slightly different anxieties. Everyone has a personal decision to make. So it's really a collaborative approach. So I'll present the information and my advice. The National Hospital for Neurology and Neurosurgery is a centre of excellence, and I know everyone says that, but it is a national hospital which provides a high standard of care to the UK and to other hospitals. Even though they may have a neurosurgical department, they may want to refer their patients to this hospital. And so we have a level of expertise and facility that is second to none. And I think partly the multidisciplinary team meetings that happens between different neurosurgeons prior to embarking on treatment, a lot of this happens in the background, but it's a useful check. It's a useful sort of way of keeping standards high, as well as having the expertise and the patient care which we have here.